Hi guys, it's Nancy from Reset Equine here, and I just wanted to have a quick chat to you, 5-minute moments of wisdom, hopefully it's wise, about the very commonly raised question which I encounter with my clients, and that relates to basically the influence of the saddle and really how much it can be influencing the horse's capacity to move correctly, pain in different areas of the horse, and really to what degree does a poorly fitting saddle basically influence the horse. And I'm going to basically start off with having a quick look at what we know about the spine, basically, because this is where it's all coming from. There is a commonly held thought that, okay, my horse isn't sore over its back, but there is reduced coxofemoral flexion, so hip flexion, extension, reduction in capacity to move correctly. Why would my horse's poorly fitting saddle be, creating a situation where they've got sore adductor muscles, or their movement in the hindquarters has become naturally more tending towards the medial, so they're stepping underneath themselves in their tracking movement more. So there's lots of questions that often come to bear as to why could this possibly be a result of a poorly fitting saddle. And the fundamental point that I want to get across is the fact that really when we think about it, where we're placing our saddle on our horse is like putting pressure on the communication systems of the animal. So having a quick look at the spine, basically, so there's just our dodgy horse head. We've got our cervical spine, but the main area that we're actually influencing directly when we're placing a saddle that could be poorly fitting on a horse's back is over this thoracic region, and potentially influencing the lumbar region as well of the horse. So we're influencing the thoracic, mid-thoracic, late thoracic, and lumbar thoracic junction of the horse. Now, in placing pressure downward on the horse, and potentially also either side of the spine from a saddle, that does occur as well, of course, what we're doing is we're actually potentially, and always going to be, to a degree, impinging on the natural movement of this thoracic spine. Now, what we need to bear in mind is with the thoracic spine is it's only about from this point, this midpoint backwards, that we do have such a degree of lateral flexion, which is when the spine can move from side to side underneath us, from left to right. Whereas in front of this, it's very, very reduced. So what the normal movement of the spine does basically to make up for this lack of lateral flexion capacity in the cranial section of the thoracic spine is it actually does lateral rotation. Excuse me for a moment while I just press a button on the phone. So it actually does lateral rotation. And what that means is basically, if you can imagine a segment basically of we're looking from the back of the horse front forwards, is we've got basically one spine, one vertebrae, and another vertebrae, and another vertebrae, and they're all stacked on each other. But during the horse's natural movement, what will actually occur is we'll get a fanning of the vertebrae basically from that central axis point. So what it's doing is it's actually rotating around the spinal cord. Now, this is a normal pattern of movement, and it needs to occur basically with our lateroflexion. So from side to side, from left to right, we need to have this lateral rotation occurring of the vertebrae, and we also need to have our flexion of the spine occurring downwards to oppose the closure of the foramen, which are small openings between the vertebrae where the actual nerve pathways come from the spine. If we're not allowing these correct movements to occur, what we're doing is we're actually impinging on that space, and we get reactionary and inflammatory responses, reduction, increase of fluid, and we get a change in the way that the actual nerves can respond. Now, okay, so we think, all right, well why isn't my horse sore on its back then? Chances are there is a level of discomfort on correct palpation detected, but often what we notice is because of the fact that all these nerves basically, which are coming out in between each of those vertebral points, along every single point of the horse's body from top to toe, so we're not just talking about the the cervical or the thoracic vertebrae all the way through the horse, and those are coming down ventrally, so towards the bottom of the horse, inside the horse from the spine, and they're also coming out the side of the horse basically, so either side of the horse's spine. If we close these spaces through tension and poor posture, and from pressure from a saddle, then from a rider, and also a rigid saddle which doesn't allow correct movement of the actual spine, what we do is we affect the capacity of those nerves to actually influence what they need to influence to create a normal movement pattern and response. So what you'll actually have in some situation is reduced capacity to actually flex the hip of the horse, for example. So you're talking about your lumbar vertebral nerves, which are basically affecting the flexural capacity of the quadriceps or your TFL. If that's not innervating correctly, for us we go, okay, we've got pins and needles, but for the horse, if they can't communicate at that level, if they're getting a reduced sensation and capacity to actually innervate or use that nerve or get the response from that nerve to where it needs to be, it's going to reduce the capacity to move correctly. The other thing you'll get is you'll get localized discomfort. Nerves, they are sensory as well, so they're going to provide that sensory feedback to the environment. One of the most important survival aspects of the sensory nerves is providing pain. So if you're not actually going to be functioning correctly as a nerve, you could actually be creating localized pain issues. One of the common ones I see is pain and discomfort through the gluteal groups, and it is incredibly common to get hypersensitivity on the actual cutaneous or the skin of this tissue, as well as deep pain within the tissue. It's not necessarily an issue within that muscle itself, but it's actually spanning from a reduction in functionality through the functional spine, basically, in functional movement. So bear in mind next time that there are broader issues going on with the horse, and I know we can get very overwhelmed with what we need to know and we need to do, but it's also very important to bear in mind the fact that the horse doesn't function as a single unit. There are many aspects of the horse which rely on balance through other regions of their functionality to create that whole picture which we use in our performance work and in our expectations of them as being a whole being. The simple saying of a horse, it's not just a horse, it's many aspects that need to work in balance together to create the end result of being a horse and being something that we can ride. So if influences of that central spine will hugely influence every aspect of the horse. So next time, bear in mind when your body worker or your chiropractor or your instructor or your saddle fitter says to you, I think most of these issues are coming through from saddle fit, the chances are that they're often very correct if the issue is occurring in the presence of a poorly fitting saddle. It is vital that the spine has freedom to move, and freedom to move to then develop strength to support itself. Once you start to have issues with supporting the spine in freedom of movement and correct functionality of movement, you start to have major issues from the nose to the tip of the tail in regards to comfort, functionality of movement, and capacity to neurologically respond to the environment. So, the influence of the spine is very broad, and the influence of the pressure of that saddle and its capacity to allow movement or inhibit movement is as broad as well. That's enough from me today. I'm sure we'll chat more on this later. Have a great afternoon.